I'm fascinated because, there's effects on disease states or, things that are problematic for people like PTSD, traumatic brain injury, depression, et cetera. But then there's the brain enhancement component.
Yeah.
And I know a number of people who've gone down there into Mexico and didn't have these problems, but used it as a way to sort of create neurocognitive and neuropsychiatric enhancement. And you mentioned briefly about reversal of the brain age as sort of a hint at that. Can you talk more about how it might be used as a sort of an enhancement drug? In other words, that it doesn't just treat disease, that it may actually improve your overall cognitive function, memory, mood, neuroplasticity, neurogenesis, and things that, we all would like to have better brains, right?
Yeah, so what we observed in the veterans was that they had an improvement in a statistically significant improvement in some aspects of cognition, particularly around frontal control. It's an open question as to whether or not in a non-TBI, non-PTSD individual, you're going to see that too. But, at least you can see in a diseased population an improvement there. Whereas like with a lot of the oral antidepressants and whatnot, you're not really seeing an improvement in cognition. There's not really a good drug in psychiatry that's approved for depression that improves cognition. And so at least we're getting signals of it with Ibogaine, but it's got to be studied.
Yeah, it would be interesting as more of like a longevity enhancement drug. And we don't really think much about those things in medicine at all. We think about things that suppress or inhibit or block some pathway rather than things that optimize, enhance, and improve the functioning of human physiology.